Turning to our sugar tax series, we've spoken to a dietitian at the Bermuda Diabetes Association, food and beverage distributors, and an OBA MP. Tonight we sit down with Minister of Health Kim Wilson.
We want to make sure that Bermuda is healthy, and unfortunately we have high instances of chronic non-communicable diseases. 3/4 of our population, adult population, are either obese or overweight. So we need to take steps to try to curtail that. Will the sugar tax do it on its own? No, absolutely not. But when you look at other jurisdictions who have implemented the sugar tax, and the World Health Organization is a high proponent of it, and they've indicated that economic tools help to work to curb behavior. And we are seeing changes in our behavior insofar as the consumption of sugary sugary drinks. The STEP survey in 2014 showed that on average Bermudians were consuming a minimal, 50% of Bermudian adults were consuming 1 to 2 cans a day, and we've seen a reduction to 42%. So we're seeing a reduction, so it is working. Yes, it is early days. A person spoke to me about, they saw the canned diet soda that we all know and it has no sugar next to the one that has sugar, and you look at the labels and they're the exact same cost. And the question for the consumer is why, and that's what we're addressing with the grocery stores. At the same time, when we implemented the sugar tax, the government did a number of things. They did reduce the duty on water, as well as they eliminated the duty on fruits and vegetables. Broccoli, potatoes, turnips, oranges, apples, things that you and I probably have in our basket every week. We reduced the duty to 0%, and that has not been passed on to the consumer.
Obviously, it's very important to measure the success of the sugar tax. How will you be able to do that effectively to find out, how well it's doing and if it needs to be tweaked?
We have done an omnibus survey, and the omnibus survey did show that the consumption with respect to sugary drinks has gone down from 50% to 42%, and that was just done, I think, up until December of last year. Recently, it was a recent survey. At the end of March, we will then have the sugar tax implemented, first of the 50%, as you said, and then 75%, and we'll be able to quantify how much money has been generated thus far. And as the Premier announced in June 2018, when we were actually debating the sugar tax, that the proceeds would be earmarked for healthy initiatives. We have a couple of initiatives that are ongoing within the ministry. One is taking it to the streets, which we have our community health providers going into the community at places that may be frequented by individuals that don't necessarily take care of themselves. In addition, we have the Healthy Schools Initiative, which is to help to teach our children what is important about a healthy diet. And we have effectively a competition every year where they have to produce a healthy lunchbox, and they have to explain why is that more important to have the carrot and the apple as opposed to the candy bar and the bag of chips.
If you find that the sugar tax is maybe not as effective as you thought, will there be changes? Are you willing to make changes as far as reducing the tax?
So we're not anticipating there'll be any changes at this point because we're seeing results. I'll report back to you when we receive more information from Public Health England when that data has been collected and they've completed that research.
So the public can be reassured that they're going to get very specific, independent, data on the results of what's going on.
Absolutely.
So that's important.
Yes.